It's the watchword of the modern age.
Talking about
Rising mental health
The
issues.
mental health
exposed to mental health condition.
The government is making mental health and well-being a key priority in our national agenda.
There's no health without mental health. But what is the mental health situation in Singapore, and how are we tackling it? To frame the discussion, let's go back to a pivotal moment when the mental well-being of the country was in the spotlight: the COVID-19 pandemic.
After the circuit breaker was introduced, we observed an increase in the utilization of mental health services.
It was such a concern that the COVID-19 Mental Wellness Task Force was started by the Health Ministry. It eventually became the Interagency Task Force on Mental Health and Wellbeing, chaired by Dr. Janil Puthucheary.
As we went through COVID, we learned a lot of lessons: what works, what doesn't work, how do people react, how do people behave. When COVID passed, we had already had this idea about re-strategizing around mental health.
The rise in mental health issues has also coincided with the seismic growth of smartphones and social media.
Gaming addiction, bullying, our sense of self-worth. These causes of mental health disorders have been amplified by digital technologies and social media. A recent National Youth Mental Health study said 1 in 3 youth in Singapore have experienced poor mental health. Research around the world has also found that adolescents who spend more than 3 hours a day on social media may be at heightened risk for mental health problems, particularly mood and anxiety disorders. So what are we doing about it? In Singapore, schools are banning smartphones to get students to talk to their friends. Active aging centres provide a space for seniors to socialise. There are plans to increase the number of psychiatrists and psychologists. A new mental health helpline will start in 2025. A national mental health competency training framework will train professionals and volunteers to better communicate and help those in distress.
It's like a no wrong door policy, that it shouldn't matter where you go to, as long as it's someone you have the comfort with. For some people, that'll be a social worker, someone in a social service agency, could be a general practitioner, could be a polyclinic, could be a counsellor, could be a colleague at work.
Many factors contribute to our mental health: our environment and living conditions, genetics, whether we have experienced some sort of trauma. Smartphones and life in a busy city can build walls between us. But rather than breaking down these walls, we can look for pathways and spaces to reach out and rebuild connections. And it is increasingly apparent that connections are a big part of the solution. So our approach to mental health should not be a you thing, but an us.